expert, one of the leading experts in dry eye, and you're also talking a lot more about retinal issues and many other issues. You're one of the leading experts, one of the most sought after speakers. I think most of the people here, especially if they're in optometry, know who you are. But if you maybe want to take maybe 30 seconds or a minute and introduce yourself to everybody, a little bit about your background, because you really are one of the foremost authorities in optometry, and then share a little bit about your opinion on this technology and maybe give some advice to some of your colleagues.
Well, thanks, Stephen. It's great following Andy, too. I love how he just kind of just says it as it is. I got to be, he's that assertive that you just described with the flooring and does it so well. That was great. And of course, I've been lucky to not only hear from Trevor before, but Trevor helped set this up in my office. So it was, he was really instrumental, and his passion came through, and it really has made a big difference. So I practiced in Lexington, Kentucky, primarily at Kentucky Eye Institute, but I also see patients out of Carmel, Indiana, which is about 3 hours away, and in Louisville, Kentucky. Chief clinical editor for Review. So I think that's the journal he's referring to. Right on, Stephen. But yeah, retina's been kind of a neat passion. I'm not known for it. And in fact, it was such a weakness a number of years ago that, trying to run or be head of content for Review of Optometry, I realized when I got to the retina section, I was really lacking and wasn't really doing a good job. Even though I had patients all the time, I never really, saw it as an area that I had expertise in. So when we had 3 children in 2 years, which I would recommend that speed, I took some time off from traveling to be home, and I filled, they had a preceptorship in retina, so I took a year of doing that. It was great experience. So it was a top 20 retina practice. But it got me realizing the important opportunity for optometry, that this is an area that we really have to own. There's as many as 20 million people. And that's an underestimate. I thought there was, there's 10 million with AMD, and they say there's about half of the number of patients with it. So that's 20 million people out there who are kind of on their way. But I was listening to Jeff Gerson do a talk in one of my programs, and he said he just decided to look for, with dark eye optometry, the number of patients that are over age 60, and actually 40% of the patients had key signs that were indicating AMD. So we have to do a better job of getting them on nutrition early. For me, what really was the key and why I approached Trevor and Stephen with getting in, this in my practice, and I've purchased it just like everybody here. So it wasn't given to me or anything like that. And I'm selective in what I choose, but I felt like I could identify early AMD with those technologies. I could identify those that were more advanced. But I didn't have anything to really push them onto the nutrition side, because I didn't have a way of monitoring what's going on. Like, you wouldn't do dark eye optometry every time they came in. You wouldn't see any difference. But you could sure check their carotenoids, and you can measure that. And so that biophotonic scanner really made such a difference in my clinic. And truly, I guess I'm good at telling patients, here's what's going on, but they really want to see something. They don't want me saying, okay, you got to quit smoking, because they've heard that enough times. Okay, you've got to get on better nutrition. You got to, do whole body nutrition besides taking care of the carotenoids in the back of your eye. You've got to, exercise, even if it's just walking. And sure, we can say that to people, but they won't do it unless they have a reason. You have to show them a picture's worth 1,000 words. If I show them their carotenoid score on the scanner and I say, here's where you're at, and our goal is to get you here, because if we keep in this path, you're going to develop AMD, or you're seeing we see that you already have early AMD. That even pushes them further. And now I have a way of monitoring that and of their risk and of their progression. If they stay low on their scanner and they're not doing a good job, I also need to see them sooner, because they're probably going to develop wet AMD. And if they move up and they're faster, they're doing what they need to be, I can reassure them, which encourages them even more, and they keep on going. And I think we do, like Trevor said, change a lot of lives because of this. But there's a study by Nolan, who I greatly respect. He developed a great carotenoids, done on a lot of things, of supplements, stuff like that. And you can combine products like that with whole body nutrition out of Pharmanex. But he did a report, and he's independent. He's not related to this at all. And he found that the best way to monitor as a proxy of macular pigments was actually the biophotonic hand scanner, which Pharmanex has. Because MPOD and looking at pigment it's subjective, it's not going to be accurate. This was our most accurate proxy of how much pigment is in your macula. And for me, that was actually after I purchased it, but that just convinced me, put me over the top, made me realize this is exactly the way I need to be managing AMD. And you can sell, your blue or high visible energy blocking lenses if you believe that. And I think there is something to that, certainly circadian rhythms. You can sell, your spectacles, your sunglasses that have the right protection. You get them on whole body nutrition in addition. You can ensure that they're doing the right lifetime habits. You can monitor them more frequently if they're not. You do all these things that really make a difference and know when to go errands versus not, but you still have to take care of the overall health. So I know that's a lot to put in 5 minutes, but I'm passionate about it too. It works. It makes a difference. Patients see it and they get it. And that's the numbers and that's the visual they need to be able to make a difference. And this COVID environment's really proven itself out that we have to take good care of our health.
Yeah, and Paul, really, really great words. And some of the probably one of the questions that I've gotten recently by a handful of eye doctors is, okay, I'm an eye doctor. I should only be recommending an eye formula. Anything outside of the eye formula, is that outside of my wheelhouse? And is that uncomfortable? Is that not the right thing to do? I know you've been, I've heard you talk a little bit about when to recommend an eye formula and when to recommend a whole body formula and why. Do you mind just expanding upon that? Because it is a common question that your colleagues ask.
Oh, not at all. I'm glad to do that. I think we have to realize that patients do see us as physicians, and by Medicare standards, we are physicians. We're in that classification. And so they come in to see an eye doctor. That's what they expect, especially nowadays. I mean, most of us are doing medical optometry, medical eye care. Most of us have that component, even when I'm in Louisville, which is more of a primary care setting with optical and contact lenses, which I don't have here in Lexington. We're still do some medical. And so it is a combination of that they see. And they expect us to do that. They expect us to bring up smoking cessation as physicians. They expect us to talk about whole body. So my differential really depends on what the testing shows. So if I have a person who perhaps does show some early signs of AMD or dark head optometry failure, I tend to talk to them about the combination of both carotenoid supplements to try and get that pigment up in their macula, but also the entire whole body component. If you look at the amount of diabetes, for example, out there, 32 million people, and their estimates are 75 million or a total if you include pre-diabetic patients. Those are patients that are in our wheelhouse all the time. There are patients that are progressing in terms of their diabetic retinopathy. There's not, you're not going to help them with just macular or at all with really macular pigments that we're aware of, but you are going to help them with whole body formulations. My family, as you said, takes this product. It's what I take. It works really well. I feel, it's a high quality product. And so I can say that to patients too. They do get that. I also believe that if you have low carotenoid scores, but you're a younger patient, that's why you want to do it on everybody. I think whole body nutrition is the necessity at that point. As at certain points, though, we see other signs going on or we realize there's more to it. I think the combination of them helps. But I feel like even if you control the pigment, you still have to control the overall body's nutrition because that plays a key role in the vasculature and the blood supply and the way that our mitochondria work. And all those are essential to disease. I have patients where I cannot clear their dry eye disease, for example, no matter what I try. And it's always because of some systemic compromise that's playing a role. Like later we discover it was thyroid disease, or later we discover it was poor nutrition, or later we discover something's there. So to say that you just want to focus on the eyes doesn't work. That's like saying the eyes are disconnected from the body, and it's all part of one system. So we have to really continue to advance, and patients like that. They get it. They understand the whole big picture of what's going on. It seems to flow very easily. At first I thought it'd be a challenge, but it really hasn't turned out to be in any way either.
Yeah, awesome. Well, thanks so much, Paul. Any other things that you'd like to wrap up with before we finish up this webinar? Maybe, if there are eye doctors listening here and they're wondering if this is a good fit for your practice, do you see that? Who would you recommend gets the technology?
I really think that, well, I'm with Andy. I think if you're practicing any level of medical eye care, which we all should be, you should be looking at this technology. You're going to find just so much ease when you're managing that, patients that are, anybody over 60 is going to be a high percentage of issue potential there. And as their carotenoid numbers start to decrease, you're going to save those patients. If you've got any AMD patients, now you have a way to monitor them that you never had before. So I think if you manage those patients, you need to have it. And there's a lot to that group. I mean, if they're true intermediate stage, then you got to have an AREDS formulation with the whole body. If they're not, it's just a carotenoid formulation with the body, whole body formulation. So you really can customize how you're treating. You're almost like prescribing, but it's more on the nutritional basis, which is, in my opinion, a better way to manage health than just medicine all the time and just Western type of approaches to pharmaceuticals. So I like that kind of combination. So I think I think we all should. I'm with Andy on that, but I think if you're doing anything that was involving AMD or any medical eye care, this gives you one of the, gives you the measurement that you need to have to kind of understand what's going on in the back of the eye.
All right. Well, thanks so much, Dr. Karpechi, for joining us. Have a great evening with the rest of with your family.
Thank you for having me.
We'll get to see each other at a conference one of these days soon. So have a great evening.
Part of that, Stephen. Thanks for letting me just pop on like that. But good presentation tonight.